talk is by Dr. Sanjay Sharma. Are you here? Yes, please come. Is Dr. Shireen Fida also here? Please be ready, huh? You'll be next.
Good evening, everyone. So the aim of my study was to compare the outcome of Muller muscle conjunctival resection and small incision ptosis surgery in mild involutional ptosis. So adults diagnosed with mild involutional ptosis above 50 years of age with good levator function and good Bell's phenomena were included in the study, and the patients with other causes of ptosis were excluded from the study, and who has undergone prior ptosis surgery were excluded from the study. The outcome was measured based on the preoperative and postoperative palpebral fissure height, postoperative marginal reflex distance 1, procedural timing, lid contour, and postoperative pain and discomfort. It was a comparative interventional prospective study performed between January 2023 and January 2024. A written informed consent was obtained, and the study population was divided into two study groups, that is small incision ptosis surgery with a sample size of 31 and Muller muscle conjunctival resection with sample size of 31. Allocation to the two groups was made by systematic random sampling. So in small incision ptosis surgery, horizontal incision of 8 mm on the lid crease was made, orbicularis was dissected and tarsal plate was visualized. The levator aponeurosis was dissected superiorly, and a double arm 50 Vicryl suture was passed and adjusted until the height and contour were optimal, and tied with the skin was closed with 60 Vicryl suture. In MMCR, the upper eyelid was double everted and markings were made. 60 black silk suture was placed to mark the site and tented up. Pertamen clamp was placed, tissue was excised, and suture was passed then in a running fashion. And it was externalized. And then coming to the results, the difference in MRD1 before and after surgery was significant in both the groups, but the intergroup difference was not statistically significant. The average postoperative palpebral fissure height increased significantly in both the groups. The time taken for the procedure, pain and discomfort was less in MMCR group compared to small incision ptosis surgery group. The lid contour, the MMCR and small incision showed a significant difference in the eyelid position at the temporal 2 mm, 4 mm, 6 mm and 8 mm points post-operatively. But in MMCR group at T2 and T4 point, there was a notching, whereas in small incision ptosis surgery, there was a smooth and rounded contour. So the increase in MRD1 post-operatively was significant in both MMCR and small incision group. The difference in time taken by both procedure was significant with less operative time in MMCR procedure. The pain and discomfort in the small incision group was more than that in MMCR group. As per an article by Jacqueline et al., external approach can be done for all types of ptosis, but internal approach can be used only for mild ptosis. Intraoperative modification is possible with external approach. Conjunctiva is preserved in external approach, while internal approach spares the tarsus. As per the study by Raman Malhotra et al., avoiding violation of the septum, particularly medially, may avoid disruption of the fibers of the medial horn of LPS that continue anteriorly as a septum. The orbital sparing nature of both surgical procedure in this study can be the reason for the good cosmetic outcome of lid contour in the study population in both the groups. So to conclude, MMCR and small incision ptosis surgery both resulted in improvement of MRD1 and palpebral fissure height post-operatively. The pain, discomfort and time taken for the procedure was less in the MMCR group. Both the surgeries have good lid contour, but in small incision it was cosmetically better. Both the surgeries are equally effective in mild involutional ptosis, and either of the procedures can be performed depending on respective pros and cons.
Okay, thank you, Doctor. But why do you call it involutional ptosis?
Because this was done in patients who have ptosis on age-related ptosis, like.
Maybe you could have called it acquired ptosis as opposed to, because involutional ptosis then also has some stretching of the aponeurosis. There will be a little bit of, dermatochalasis, and also maybe you should not call it involutional, but maybe acquired.
You can call it fascicular surgery.
It's modification of that, ma'am.
Modified fascicular surgery.
Okay.
Actually, in fascicular surgery, conjunctiva and tarsal plates are innocent. And resection of both of those normal structures is not actually physiological. Okay.
Yeah, that's what he's saying, but he's... Okay, next, thank you.